Thank you, Minister, and good morning. So 2,179 cases yesterday, so that really rather backs up the high number we had yesterday. So we're not dealing with a one-off high number from yesterday's numbers. We're clearly seeing another step up in the number of cases we're dealing with here in Victoria, 21,324 active cases of COVID in our community. And that means, with 55% of new cases overnight being new cases in new households, that's over 1,000 households again today, yesterday, getting the news that they've got a COVID positive case. And we know with a high attack rate of coronavirus, of Delta strain within households, we'll expect to see significantly more numbers coming out of those new households over the coming days and weeks. So these are, as ever, worrying numbers. And I'll come on to the vaccine profile in a moment. In terms of distribution, again, the same distribution really that we've seen over the last few weeks. Just over a quarter of our cases in the northern suburbs, with 585 cases in the northern suburbs. Around just under a third in the western suburbs, with 669 cases out in the west. The southeast continues to grow significantly, with 616 cases, well over a quarter, and that continues to become a growing share of our total cases. 100 cases in the eastern suburbs. And in terms of regional Victoria, again, we're seeing that continual drip feed of cases in regional Victoria. 193 cases in total in Victoria, or in new cases in regional Victoria. That's around 9% of the share of total cases, and now 1,418 active cases in regional Vic across various different parts of the state. The regional Victorian towns I'll just call out in particular, 26 new cases in Greater Shepparton, and the vast majority of those are linked, and we understand those connections very well. And my thanks to the team at Goulburn Valley Health for the phenomenal work they're doing to support their local communities, and particularly, of course, with some challenges around some of the school exposures that we've seen there. We have 28 cases in the Geelong area, or in Greater Geelong. 19 of those are firmly linked. We have ongoing investigations around the other 9. There's a number of isolated cases along the Surf Coast. All of those are well and effectively linked. And again, my thanks to the Barwon Health team for the really phenomenal work they've done to keep a lid on those Geelong exposures. We have 21 cases in the Latrobe Valley, all of those well linked and connected into the existing outbreak, and 20 cases in Baw Baw Shire across that social exposure around Jeroen and Warragul. Again, linked to a number of understood social connections and household connections. As the Minister said, we had 34 cases in Mildura today. The vast majority of those within Mildura, a few isolated cases in Swan Hill and in Robinvale. And again, my thanks to the very strong multi-agency effort underway in Mildura to support the community again through another 7 days of lockdown. But we're really very keen to make sure that those cases are well supported, and that we uncover any final remaining cases that are still to be found, with a high number coming in yesterday, of course, impacting our view on that outbreak. Just a word around, obviously, as the Education Minister and the Deputy Premier said yesterday, around schools returning. There's a huge amount of preparation being done by schools and the Education Department around VCE. VCE starting off again next week, and my thanks to the whole school community and the many anxious parents and students as they prepare for that final stage in their educational journey. There is a lot of work now underway to support those Year 12 students and Year 11 students to undertake their VCEs safely and effectively. We have now in the Department of Health put in place a series of arrangements that ensures that any student, as we discussed yesterday, any student that may be caught up in an exposure, that may become a primary close contact, there will be arrangements in place to ensure you can take your VCE safely and effectively at school. There'll be dedicated facilities set up to enable you to undertake your exam. You will be in quarantine, but you'll be able to leave quarantine to do the your VCE exams during your quarantine period. My thanks to all the schools and the teams across education for working with us to make that possible, and for all the work that will be in place. I know it'll be a very complex and anxious time for a number of schools over the coming weeks as we see COVID in and out of our school communities, but we're all very focused on making sure that VCE students in particular get a fair go and a clear run at getting their exams done at this critical time. In terms of vaccination, we continue a wide range of community pop-up sites to really boost not only the wonderful work of our GPs and pharmacists, and of course the extensive network of state clinics, to really continue to do all we can to reach those furthest corners of the state and our communities to get the vaccination job done. We have 5 additional community pop-ups starting in some of our areas where we feel we need to boost further the first and second dose vaccination rates. And they include the East Reservoir Senior Citizen Centre, which will be open on Monday and Tuesday next week. The Kingsbury Bowling Club will be open on Wednesday and Thursday next week. The Craigieburn Sports Stadium, which will be open on Tuesday and Wednesday next week. The EACH building on the Warburton Highway at Yarra Junction, and that'll be open all of next week. And the Faulkner Community Hall, again, open Monday to Thursday. And in particular, with regard to the last site, the Faulkner Community Hall site, that will have a disability-specific access and services supporting it. So if you need a bit of extra support to get your vaccination, we will have experienced staff, plenty of facilities, plenty of room, and a less busy and intense environment for you to be supported to do your vaccination. I can again give a big shout out to all those disability services all across the state for the phenomenal work you're doing to support those residents and those Victorians living with disabilities to get their vaccination done. If you need any further help or assistance, please do get in touch with us so we can ensure that everybody is protected with a vaccine in the days and weeks ahead. Finally, from me, just in terms of vaccinations, as the Minister has said, 88% first dose for those aged over 16, 63% fully vaccinated Victorians aged 16 and above. Again, those of us over the age of 40, not only are the first dose rates continuing to rise, now at between 91 and 95% of Victorians aged over 40 are now first dose vaccinated. The second dose rates are also starting to trend exceptionally well, with, for the over 40s, between 73 to 82%, depending on which age cohort, being fully vaccinated. The 12 to 15-year-olds continue to do a fantastic job, and now 7 out of 10 12 to 15-year-olds are first dose vaccinated, and their second dose rates are also starting to lift. Vaccination is important, and again, looking at our local data here yesterday, 67% of yesterday's total case numbers were unvaccinated. Of the 700 or so people in hospital yesterday, 3/4 were unvaccinated. And of those 150 or so in intensive care yesterday, 87% were unvaccinated. If I turn that round, only 12% of the people who turned positive yesterday were vaccinated. Only 10% of those in hospital yesterday were vaccinated, and only 2% of those in intensive care yesterday were vaccinated. This is why vaccination is our way out of this, and this is why it's so critically important that we all protect ourselves to get vaccinated, to get fully vaccinated as swiftly and as safely as possible. Our Victorian data, based on the work that our clinical teams have done, shows that unvaccinated people here in Victoria right now are 10 times more likely to catch COVID than somebody who is fully vaccinated. That is the data that we're seeing take place here. That is higher, indicates a higher trend than we've seen in some of the literature, but it highlights again that if you're not vaccinated, you are far more likely to be caught up with COVID and far more likely to end up in hospital and in intensive care. So please, we'd urge you, now is the time for us to get that vaccination done, particularly as we start to see increasing levels of movement, as kids go back to school, and as those milestones ahead of us start to open up. You will be at far greater risk if you don't get your vaccination done.